All right, explain speaker therapy. We all need therapy, but we really need help, which is what this thing really is.
It is.
What is it?
So C Agency has a speaker therapy division. We have a registered therapist on
Yes.
staff. She actually, Sarah Norris, who has been with C Agency for several years, a handful of years, almost 5 now. She started in the ranks. She started as like my assistant and then worked up through sales and all of the things. She actually ran logistics on dates. So she's done every aspect of the business. She did all this while she was getting her master's in counseling, and she now has a thriving therapy practice.
Mm-hmm.
And the idea for this came because I didn't want to lose her from C Agency, and she didn't want to leave. And I said, this sounds crazy, but I think we kind of need a therapist on staff. And it is not crazy at all, because now we're realizing, it was something we test drove for a little while and went, wow, this is actually a good idea. So what Sarah does for our speakers is she makes sure that the materials that we have are not creating any barriers to bookings, so that the brand is consistent with who the speaker is and who they want to be, that the fee is in the right place, that the video looks good, that the headshot is right, that, when we have new materials. So she does that for the speakers on our roster.
Mm-hmm.
And we realize that there's a huge need also for outside of our roster. And so this is something that we're now outsourcing, or not outsourcing, or
Adding to the mix.
Yeah, adding to the mix, I guess.
So basically, as speakers, we're a little close to the situation.
Right.
And we put our marketing materials together in a vacuum.
Yeah.
And we don't know if a video is working for us against us. Maybe we don't have a video.
What you don't know. And that's the
one-sheeter,
thing.
10 sheets, whatever it is. And then so you'll look at it, and you've been on both sides. You've worked with bureaus as an agent. So all of you look through, and Sierra looks through, and what does she find?
What we want to do for what she does for our speakers, and what we want to do in general, is make sure that our speakers are as bookable as possible, so that there are no barriers to speakers bureaus representing or recommending them. And we realize that's what other speakers need too. There's just they are, like you said, too close to the situation. They don't see their blind spots. So that's what Sarah's been doing, and with great success to some pretty
blind spots.
Yes, the blind spots.
And it's clever. I know you call it speaker therapy, because sometimes we're just so close we don't know who we are.
This is it. Yeah,
right.
I know. It's a very short walk. That conversation's always surprisingly short. Sarah will talk to a speaker and say, "Okay, so tell me about yourself." Well, I speak on accounting, and I also do slam poetry.
Right.
And she says, well, who are you at your core? And they go, I don't know who I am. And then it turns into a therapy session immediately.
How do you market that?
Yeah.
So you'll help focus people in. Your agency will, with this program, will help focus people in. And then they could be more bookable.
Yeah. And this therapy it's a never-ending process. So we've kind of packaged it into a very compressed thing, where she does an intake questionnaire, like in her regular therapy practice, an intake questionnaire, and then there's an interview and a summary, and then the diagnostic and recommendations for, eliminating the blind spots, I guess, or eliminating the barriers to bookings. So
we got to eliminate blind spots.
I know. It's all about just doing as much with what you have as you can, and not being your own worst enemy and getting in your own way.
Fantastic.